Welcome to our New Year, New You workshop series. We are in our third week of our 8-week series. And just as a reminder, there is no January 31st workshop. We're going to be rolling into February and carrying on into that month with our series. I am Dr. Barbie Phillips, and I am a chiropractor for people and animals. And I have been in business 23 years. My office is Creation Chiropractic, located south of Fargo, Oklahoma. And my wonderful co-host tonight is Kathleen, and I'm going to let her introduce herself tonight.
Well, good evening, everybody. I'm Kathleen Oliveri. It's my pleasure to be here with you tonight at this ongoing series of really fabulous topics that certainly I can relate to, and I'm sure you can too, with the different topics that we'll be talking about. I live in Mississippi. I'm retired from Mississippi State University, where I worked in IT infrastructure and also taught in the College of Business. And in retirement, I still teach for the university, but only part-time. And so we're so glad to have you here tonight. So the topic is muscle and joint discomfort. And, raise your hand if you're like me. I mean, do you have some type of severe joint discomfort? Many of us can. There's a very startling statistic. 1 in 4 adults have some type of muscle discomfort. That means 15 million Americans. So the good news is you're not alone. The bad news is you have muscle and joint discomfort. So Barbie, tell us more about this.
All right, I would love to. The types of discomfort that are often reported are arthritis, which is inflammation of one or more joints, causing muscle pain and stiffness. Symptoms can cause decreased range of motion of the joints. It can cause intermittent pain and even just stiffness when you're trying to move around. So that's never a fun one. Osteoarthritis is another one that's often reported. It occurs when flexible tissue at the ends of the bones, where it connects to the bones, actually wears down, and that can cause joint stiffness, crackling joints. And sometimes you bend and you hear that cracking, and then joint deformity, even where those tissues and ligaments pull against the bones. It can cause deformity of the joints. Rheumatoid arthritis is another one. It's an autoimmune issue that can cause issues where the immune system actually attacks healthy body tissue, and it can cause chronic inflammation in the joints, muscles, and even the fibrous tissues. Symptoms include joint discomfort, recurring flare-ups that occur over and over, and then fatigue and tiredness actually goes along with that as well. Then there's TMJ, or jaw dysfunction. That's a pretty common concern, and it's discomfort and compromised movement of the jaw joint and the surrounding muscles. And the muscles actually go up into a head that attach to the jaw, as well as on the face. So there can be issues with that, including facial pain, difficulty chewing. Sometimes that's painful, sometimes it's not. Cracking or popping of the jaw joints. There's another one that's called fibromyalgia, and that is stiffness and pain that's kind of all over the body. There are certain pressure points that they check for that. And the symptoms can include fatigue and tiredness, depression, anxiety goes along with that, sleep problems from discomfort, issues with memory, thinking, and concentration, and even headaches or migraines can be associated with that as well. Then there's chronic pain, and it's caused by an inflammatory disorder of some kind in the body. So somebody might report having chronic neck pain or chronic back pain, or even chronic joint pain, and it could be in multiple areas. Muscle tightness and spasms is the last one that I have on my list for tonight. And it's involuntary contractions of muscles, twitching, leg cramps, or muscle pain, which a lot of those are very familiar things to a lot of us. And so we want to talk about, not only what types of muscle and joint discomfort there are, but we also want to talk about, hopefully how we can take care of some of that and feel better.
But what's interesting, Dr. Barbie, is I think that sometimes these symptoms really are not always bad. I mean, certainly you've ranged from annoying symptoms to some pretty severe type of symptoms that people could be experiencing. But I think it could be like a warning sign, a warning flag that says, hey, something's not right. So let's, look at it and see, what we can do to make things better. So symptoms may not always be a bad thing. Now, we can cover them up, which unfortunately, I can speak from my experience, is what happens a lot of the time. We just want a medication or something that's going to mask some of these symptoms to make them go away rather than get at the root cause. And I really think getting to the root cause and correct those underlying issues that are causing our discomfort in the first place, that may be the way we need to go.
Mm-hmm. I agree, Kathleen. So let's talk about ways to help the body with muscle and joint discomfort. First on my list is simple things like ice packs. We recommend that you put them on inflamed areas for about 20 minutes, maximum time. We don't want to go past that because it's just like putting a heat pack on if you leave it on too long, because the body goes into a hypothermia response, and then we start increasing blood flow and we can get increased swelling. So that's important to know there's a time frame for ice. We also can use heat, and it increases blood flow and to the tissues for healing. But we want to make sure we put those just on like tight muscles or areas like that, not areas that are actually inflamed. And then soaking in an Epsom salt bath is a wonderful thing to do because the magnesium in the salt is very healing. Our skin, our body can absorb that. The body uses that magnesium to calm a lot of those joint and muscle areas that are discomfort or uncomfortable. Taking a warm shower can also be beneficial as well. Then there's the things like massage. That's really helpful to some of these conditions. Even chiropractic adjusting and acupuncture. Those are all wonderful things that can help people manage these cases. And then there's meditation, relaxation techniques, walking, stretching. Movement is really important because a lot of times there's fluid in these joints and it's stuck there. So the more we move, the more we walk, we can move that fluid throughout our body and get it out of those joints. Increasing our water consumption is important. If we are dehydrated, our muscles they're not flexible. They don't move and bend like they should. And our muscles are over 80% water. So it's important to stay hydrated so that they move and bend and flex. And then even electrolytes. If we are deficient in things like magnesium, calcium, or potassium, those can often cause issues as well. And so making sure that we have good blood work with our doctor and such to check those, but sometimes electrolytes are needed as well. Wearing proper shoes. If we live in flip-flops and things like that, that is not helpful because our foundation to our spine and our body is our feet. So we want to make sure that we're taking care of those and keeping those nice and healthy so that everything from the ground up works well. We can also get things like custom orthotics made. We do those in our office for our clients, and they're custom to where we scan the feet and they do points on all three arches of the foot. We all think about the middle arch, which are on generic orthotics, but we don't think about the other arches. There's two other arches, the lateral and the transverse. So when you have custom ones made for your shoes, that's a win. And then if you're taking prescription drugs, sometimes those can cause muscle and joint discomfort. They might be beneficial for one thing, but there may be side effects to it. So always speaking to your doctor to see if maybe medications are causing some of this and they might need altered. Statin drugs are very, very notorious for this. They can cause a lot of chronic muscle pain. I see this with clients a lot. And then people end up with problems with that and they have to go to non-statin drugs to help them not have those discomforts. And then making dietary changes in our foods. We want to make sure we're not eating a bunch of inflammatory foods like a lot of sugar, a lot of carbohydrates, a lot of dairy products. Those are all going to cause inflammation in our joints and tissues. And so being conscientious about that too. And finally, taking helpful supplements can be a very, very wonderful way to help manage some of these cases. And so Kathleen, I'm going to let you go into speaking more about that.
Every time I listen to Dr. Barbie, I learn so much. I had no idea some of the things she just shared. And I think a lot of the suggestions she had, things that we can do were on point, but the reasons why I didn't have a clue. So thank you so much, Dr. Barbie. I always learn from you. Now, the supplements that I'm going to talk about that I take, just want to remind you that they are not intended to diagnose, treat, cure, or prevent any disease, but they truly have helped me. The first thing that I want to talk to you about is the ASEA redox signaling molecules. This is my foundation. I take this every day, and I believe that no matter what else I do, this is a must. The foundation of the redox signaling molecules. Well, what can they do? Why do we care? Well, they help detect, repair, and replace bad cells. So they do help your cells. They boost antioxidants, and they protect against free radical damage. And it just optimizes our health by helping to minimize the inflammation in our body. So we can really live a better life and help with this muscle and joint situation discomfort that you may be feeling by help repairing your cells. And this does that. And it does help open up the 5 genetic pathways of inflammation, autoimmune, hormonal, digestion, and cardiovascular. So it does help open the genetic pathways in those 5 areas. I also like it because it's 100% safe. It's clean, non-toxic. It doesn't have any kind of interactions with medications that you may be taking, and it's just native to the body. So this is definitely going to help with your muscle discomfort that you may be experiencing. This is a lot of athletes use this as well. So this is the foundation that you need. Now, along with that, something else that I use is the Renew 28, and this is a gel. This was a liquid right here, but this is a topical gel. And what this is, it's really a fabulous product. It's redox signaling molecules, but it's 3 times the strength of the liquid. So this is intense. So this helps repair cells from the outside in, whereas the liquid helps with the inside. So this is on the outside. So this can really help with those spot places that you might be having and experiencing any discomfort. I could tell you lots of different examples. I'm about to say, give you one, but just to keep it brief, that, why you need to use this is that, again, it's clean, it's dermatology tested, and it's free from artificial colors, parabens, sulfates, phthalates, all the things that we know that we really don't need, and it's cruelty free. Now, it does work in combination with it. So if you're taking this, you need to take this, and vice versa, because they do work in combination. Now, what's interesting about this is the Renew 28 will help heal the skin at the cellular level. It helps revitalize the skin. So what do you think that might be doing for some of the discomfort that you may be feeling? This is going to help with that discomfort. And certainly it does help with the appearance of your skin, but we're really focusing on those minor discomforts that you may be having. But you want to make sure you use enough of this, that when I use this on discomfort, I want to make sure that I'm using enough of it that I can rub it in 30 to 60 seconds in the area that I'm experiencing this discomfort. So my advice to you is listen to what Dr. Barbie said about all the other things, but then add this, and I think you will notice a huge difference.
Thank you, Kathleen. Those are great recommendations, and I definitely concur. When you're drinking the redox molecules, they're going to help from the inside out with those inflammatory responses. And then by putting the topical on, which is 3 times more concentrated, it absorbs through the skin very quickly into the blood supply. And then you're going to get those results pretty quickly. So if you have any closing comments, Kathleen, let me know. I think that's going to wrap us up.
Yeah. No, ma'am, I don't have any closing comments today. I think that, I learned a lot. I always do. And pairing the things that you talked about with these supplements, I think that could really help with any muscle discomfort that you may be feeling. But I do want to make sure we talk about what's coming up next week.
Yes.
And now that I said that, my sheet of paper that has on it what's coming up next week.
Energy and stamina is our topic for next week. And I think we all can use a little bit of help in those areas.
Definitely.
Yeah. All right. Well, I am going to stop the record here.